I want to point out a recent position paper by Prevention Works. Prevention Works is a coalition of approximately 14 groups, community groups, small coalitions representing the entire state of Vermont. Prevention Works recently has said in a position paper, Prevention Works and Vermont's prevention coalitions are opposed to the creation of a commercial system for retail sales of recreational marijuana, and clearly want to refute statements that commercialization of marijuana is needed to provide tax dollars for prevention services. They conclude their statement with this: we believe that science and evidence, not special interests or corporations, must drive marijuana policy in Vermont. Now, Scott, I know that you recently have said regarding this specific issue, this is an illogical trade-off. Would you care to elaborate on that?
Yeah, and I think it connects to what I ended with previously is the idea of funding prevention or after-school programs or the things of those sort with marijuana revenues is, again, it's going to increase health disparities. It's not going to fix them. Because as has been well laid out by other panelists, the fallout from marijuana use, particularly the adolescents. So we know from the research that 90% of addictions start in youth. So while I agree there are adults who are probably starting an opioid addiction because of a prescription, the vast majority of addictions are starting in adolescence, not in adulthood. And we know with marijuana, the addiction rate is 1 in 6 for young people. So what's going to happen is, those that are most vulnerable at risk are going to fall further behind, and they're not going to be able to benefit from the after-school programs or any of the other programs that you fund because their parents can't afford to give them treatment, which is already an issue. I mean, we didn't talk about that. We're already talking about a lack of access to treatment for opioids. Commercialization is only going to make that worse, not better. So I think it doesn't make any sense to fund, for the state to be in a position where they need to collect revenues from the sale of an addictive substance to fund prevention. That just doesn't make any sense. And then what happens when revenues are down? So you got to put out advertisements to increase sales, to increase the revenues for prevention. So now you got to fix these issues that come from more people using marijuana. The equation doesn't make any sense.